but are to do it with little bit of more ease. So trick is that we don't tie the corner suture. This will be 12 o'clock suture. We have already taken. It should be under little bit of tension so that the suture end remain allied. The mark basically proximal or afferent loop and inside out on the. It has always to be a double arm suture. So I'm bringing it to the normal orientation. So this will be a normal rotation of 12 o'clock. So simple trick, friends. I hope you have always to use double arm suture and always come inside out to avoid the intimate suture when the life or limb of the, otherwise they will get entangled with the next suture. So in a 6 o'clock to 12 o'clock, then we will bring hole and